Our Someone to Know is a Reno doctor. He specializes in bariatric surgery. That's a procedure that can be used to treat obesity. The disease has seen a sharp rise in the U.S., and the doctor wants to remove the stigmas that impact patients and even physicians. Meet Dr. Lars Webb.
You're in a rapid weight loss phase.
Okay. How about diabetes?
It's rapport like this with patients and prospective patients that matters most to doctor and surgeon Lars Webb.
I just fell in love with the population. It's rare, I think, in medicine, especially in general surgery. You get to follow someone for life, really, and that's the goal with bariatric surgery.
Gastric bypass surgery is just one tool, says Dr. Webb, because it's about so much more than just losing weight.
Obesity is probably the #1 health problem we have in the United States. You know, it contributes to everything: heart disease, lung disease, cancer.
And, says the doctor, the stigma surrounding obesity is what stops many people from getting the care they need.
I think that's really unfortunate, you know, and I think even I've heard providers and physicians and our nurse practitioners and our PAs say, you know, I don't feel comfortable talking about obesity.
Dr. Webb will keep trying to break down barriers and clarify misconceptions about poor lifestyle choices and character flaws. He says obesity is a disease.
A mix of things. I think we have onboard genetics, an onboard sort of endocrine system that makes us more susceptible to be obese. You know, some people aren't, some people are, right? But I do think that the environment that we live in has a lot to do with that too, and we don't get to change either one of those things.
It was almost by happenstance that Webb became interested in medicine and surgery.
I got a job when I was 18, working in the OR actually, as an orderly, mopping the floors, and just fell in love with the pace of the work there, fell in love with the people that were there.
And Northern Nevada, he has always loved.
It's always been home. I think, you know, as a kid growing up, everyone's like, I want to go somewhere else. But having been a lot of other places, there's no better place.
The doctor says he loves to be outdoors with his family. And when he's indoors, he wants to change patients' lives for the better.
To be able to have these people come in and have them for many months before surgery and have them as a patient forever after that. And I think that's one of the most important pieces of it and one of the things I like best.
If you're interested in considering bariatric surgery, there are a great many resources available to prepare you before and support you after the procedure, from classes and nutritionists to support groups like Overeaters Anonymous and much more. The surgery is minimally invasive and is covered by most insurance for those who qualify. For more details, you can check the links with the online version of this story at 2news.com. That's our Someone to Know. Coming up next.